right, so good morning.
Good
Thank
morning.
you so much for participating for this assignment and the assessment. Today we're going to go over some basic strength and balance tools and just an overall assessment of yourself. Can you go ahead and tell me your name
My name is Fred Brown,
and what's your age?
63 and a half.
And what is today's date?
It is February the 1st, 2020.
All right, and what city are we in?
I am currently in Arlington, Texas.
All right, that's all correct and good. All right, so do you have any trouble with your hearing?
Yes, I do. I've been in construction for many years and I have been around loud rock concerts and shooting and other things, so I'm probably got 50% at best.
Okay, well, we're going to do a basic hearing test just to kind of see where you're at today. So I'm going to whisper something into your ear. After I whisper it, you will say it out loud, okay?
I will try. Red brick.
Good. And then for the other ear, we'll try out another word.
Okay. Train track.
Those are both good. All right. So then, do you have any troubles with breathing?
No, I did when I was a lot larger, but I've lost a lot of weight, so I'm good.
That's good. How much weight did you lose?
About 92 pounds over a year, and I think
Wow.
I'm going to knock off another 20.
Well, that's amazing. So we're going to go ahead and test your breathing.
Okay,
So what you're going to do is you're going to occlude one nostril and then breathe in and breathe out. All right, and then with the other side. All right, did you have any troubles with that?
no,
All right, that's good. Okay, so now that we've already tested out your hearing and your breathing, I'm going to go ahead and feel your lymph nodes.
okay,
We're going to do the post-auricular, supramandibular, and then the clavicular. All of those feel good. All right, so now we're going to go ahead and take a listen to your heart and your lungs.
okay,
All right, so this is for your heart. All right, and then now we're going to listen to your lungs.
okay,
So just breathe in like normal. I'm going to get the sides. Good. And now I'm going to get your back. Again, just breathe in like normal. All right, good. Those all sounded clear.
okay,
So now that we've already gotten past that, I'm going to do some basic tests for your strength.
okay,
So I'm going to have you tilt your head forward, push against my hand, good, and back. I'm going to have you push against towards the side and towards this side. Good. Now go ahead and shrug your shoulders for me. Also good. All right. Before we move on to the other ones, we're going to go ahead and test your extra-auricular movement for your eyes.
okay,
So without moving your head, just move your eyes. We're going to follow the pen. Ready?
okay,
Good. And how long have you worn glasses?
most of my life, probably since I was 16, 15.
Okay. All right. And do you have any problems with your prescription currently?
Currently, I believe I do. I've noticed more and more of a little bit of cloudiness in my left, and I think it's my left eye which has astigmatism. So
Okay.
I believe my prescription is wrong. I'll be visiting a doctor in the next couple of weeks,
That would be good.
and probably my stigmatism has advanced and needs to be
Needs to be
something
adjusted.
done. Yes.
Okay. All right, well, be sure to go ahead and get an appointment here soon, so that way you can go ahead and either get a new prescription or follow whatever recommendations that doctor has.
Right.
So then back onto our muscle tests. We've already done the head, we've already done the shoulders. So go ahead and let me see your hands. Go ahead and squeeze mine. Good. All right, so then push down against my palms. Good, and then push up. Good. All right. So then I'm going to go ahead and test your knees. Go ahead and raise up your knees if you can for me. And both at the same time. Good. All right. So then now that we've already gone past there, I'm going to get down here towards your heels.
Okay.
So go ahead and push your heels back towards the chair. Good. All right. Can you push your feet out? And then in. Good. And then with your toes, can you point them up in the air and then down? Good. So now I'm going to go ahead and have you lift your feet up against my hands. Good. And then push as if you were on a pedal. Good. All right. So those are all very secure. You have good muscle strength from those assessments. So now we're going to do a Tinetti balance tool. What this assessment does is we're going to see how you can stand up from a chair, we're going to notice your balance, and then we're also going to watch your gait, which is how you walk down the hall and back, okay?
Okay.
Do you currently use any sort of mobility aids like a cane or a walker?
No.
All right, so that's good. So go ahead and stand up from a chair. Good. Now go ahead and stand with your feet about 4 inches apart, and then put your feet together. Good, so now we're going to do a nudge test. All I'm going to do is push against your sternum 3 times. So there's 1 and 2 and 3. Good. Now we're going to close your eyes for 10 seconds. So go ahead and close for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You can go ahead and open up your eyes. All right, so now go ahead and step away from that chair a bit. I'm going to have you turn in a circle. Doesn't matter which way, just a full circle. Good. All right, everything was very steady and secure. Did you notice any issues with that?
No.
No dizziness of any kind?
No.
Perfect. All right, so then the next portion of this assessment is we're going to watch you walk down a hall and back. You can take about 10 steps if you like. And then back. All right, very good. So no issues with walking that we've noticed. So from all of these assessments, we can go ahead and decide that you do not have any sort of fall risk.
Okay.
So those are all good. You mentioned that you do wear glasses and that you're going to get that prescription look at that. That is
Yes.
good to do annually, because having a good pair of glasses or contacts will make sure that you can see your environment and not have any falls. Do you have any sort of grandchildren?
No, dogs.
Dogs? Okay, so since you have dogs, do they like to run around?
Oh, yes.
Okay, so we'll want to make sure that they don't get trapped up underneath your feet.
They try.
So if they have little bells on their collar, that tends to help, but also just be mindful of the surroundings.
Yes.
And then
I
I
yell at them
noticed-
and tell them to go away.
That does tend to work. Good. And I notice I have a couple rugs in the house, so as long
Yes.
as they're secure, they usually have a little rubber mat on the bottom so that way they don't slide, because we don't want you to fall on any of those, or anybody for that matter.
Okay.
And then, do you happen to have any of the Google or Alexa devices in your home?
Yes, I do.
Those are pretty helpful these days. You can usually tell them in the morning to turn on the lights.
Yes.
Having a well-lit environment will ensure that you do not fall or that no harm can be done.
Okay.
All right?
Okay.
All right. Do you currently take any sort of medications?
Yes, I take 2 minor things. One is thyroid medication, levothyroxine, and I take a small blood pressure pill,
Okay.
lisinopril.
Okay. And are those working out okay for you at the moment?
The doctor says they are.
Okay. All right. And are you able to afford those with insurance?
Yes, but after talking to my mom this morning, I may increase to a different one rather than the generic levothyroxine to the full strength, the active one,
Okay.
and we'll find out.
All
So,
right. Well, feel free to bring all of that to attention to your primary care provider. They can definitely try to get you the name brand as opposed to the generic brand and test it out under their watch to make sure that works better for you. If in the event in the future that you feel that you cannot afford any of your medications though, just feel free to know that there's plenty of community areas that'll help you be able to afford them, including prescription cards and savings costs.
Okay.
All right, well thank you so much for allowing me to have you for this assessment and for this assignment.
Very good.
Thank you.
Thank you.